Good afternoon, everyone. Thank you for joining us today for another part of our diabetes series. Today, we'll be talking about coping with diabetes. My name is Dr. Maria Elena Pena. I am the Director of Endocrine Services here at Forest Hills, Mount Sinai Doctors. I'm also the Medical Director for the Diabetes Health Alliance for the entire health system. And joining me today will be our dietitian, Maria Fraga.
Hi, everyone. My name is Maria Fraga. I work here at Mount Sinai Forest Hills with Dr. Pena, and we will be talking today about coping with diabetes, along with some dietary education that I will be focusing on.
Thank you, Maria. Okay, so the goal of today's presentation will be the following. We want to discuss the impact of diabetes on our overall health. So that's not only on our heart health, our kidney health, circulation, for example, brain health, but also on our emotional health. When you have the diagnosis of diabetes, that's pretty impactful. It's something that many people feel is like almost a death sentence, depending on the experiences they've had in the past with it. For example, many of our patients, and we can go over the next slide. Many of our patients, when they have that diagnosis, they start thinking about their family members who've had diabetes. They think about, for example, a neighbor, a friend, and they remember the complications. So automatically that fear sets in. And I think that fear is the main thing that becomes a barrier in helping manage diabetes. And the thing is that diabetes has changed drastically. We have newer medications now that are more effective, have less side effects, and if anything, have positive effects on both our heart health, kidney health, and brain health. So it's very, very important to realize that. Another thing is that we have control. Diabetes is one of those illnesses where you have control because you can control it with your diet. You can control it with physical activity. Remember that when we are stressed, we tend to eat more. Our metabolism kind of shuts down. The body releases hormones that increase the fight or flight response, hormones such as adrenaline, which is epinephrine, also cortisol levels. So all of these things actually worsen your diabetes. Many of my patients tell me, oh, my diabetes is emotional. And they're partly right, because there is a component of diabetes that when you're under stress, you become a little bit more insulin resistant. And that's where people notice that increase in their glucose levels. So let's go into the next slide. So today we want to go like, how can we deal with diabetes? How can we cope with it? How can we improve outcomes? And one of the things I tell my patients is to identify a go-to group support. Even something like this, even having a family member who's on board with you, a friend, a neighbor, who when you go out, for example, you want to eat, they kind of encourage you to make the right food choices. Because I tell patients, let's say you had a patient, someone unfortunately with addiction illness, a person who is addicted to alcohol or drugs. Would you walk into a bar with this person to increase the temptation? No, you try to avoid those activities. It's almost the same thing with eating. You want to have a group that will say, you know what, yes, let's share this entree. Yes, let's go for the healthier option. So getting that support really, really helps outcomes. So even at night, making healthy meals that everyone participates, because it's not easy to cook for your child, your partner, yourself, whatever it may be. So you want to all be on the same page. That's the ideal. You also, and you can always discuss with your medical team, with a group of diabetic educators, for example, with your doctor. We can give you tips and advice, or at least direct you to resources that can help you, such as something like this. This can help you. Sharing this information with your friends and family can really help you get the support you need in order to be more compliant with healthy eating. The other thing is moving your body. I tell my patients, it's not so much exercising, it's a way of life. It's physical activity. I feel that physical activity is very different from exercising. Exercising is more of this regimen that sometimes we don't have time for. But if you're set of increasing physical activity where you say, I will park a little bit farther, assuming it's safe to park farther, I'll park a little bit farther so I can walk. I'll take the stairs instead of the elevator. I'll stretch every time that I'm sitting. Let's say many people have sedentary lifestyles or they're sitting at a desk. You can say, look, every hour I'll put a timer. That means I have to stretch or I have to, tippy toe or I need to plank. Just different ways of incorporating physical activity into your lifestyle. Something even better, you can say, okay, after dinner, I'll go for a walk with the family, or something fun like dancing or yoga, anything that you feel is sustainable and that's going to be a part of your lifestyle. That's what we're striving for. And also positivity. There is a lot to be said about having a positive attitude. Unfortunately, it appears that doctors are not and clinicians are not on board with the whole positive attitude, law of attraction, for example. All these things, I do believe, prayer, whatever it is, meditation, I believe that all of these things definitely help outcomes. It puts you in that right mindset. If you put your mind in the right direction, your body will follow through, your actions will follow through. So I really think that having a positive attitude, and I have seen it in clinical, I don't have the data or the statistics, I just seen it with my patients every day when I tell them, hey, you have diabetes, your A1C is elevated, but we can change this. And they're like, yes, on board with it, they have better outcomes. Whereas the other person, when I tell them and they're in shock, that person tends to do, it's almost like a self-fulfilling prophecy. So really having a positive attitude can help. Another thing I want to point out is that sometimes with diabetes, it's just little changes. Little changes can go a long way. And later on, Maria Fraga will talk a little bit more about nutrition. But for example, reducing juice and soda. I almost tell patients you're allotted a certain amounts of carbohydrate points and take advantage of it. Are you going to waste it on a soda or do you want to save it for your favorite pasta dish? So those are things that you need to think about when you're dealing with diabetes. And again, a good team will help you make those little changes. So the point is that yes, diabetes has a lot of complications, but unlike other health issues, this is one that you have a lot of control over. The next slide. So how can we deal with stress? So for example, we can do breathing exercises. Breathing exercises are amazing. They're quick, they're easy. You really can do them almost anywhere, even in the bathroom if you're like around coworkers. You can do it in your office space. So doing breathing exercises really helps calm you down, really decreases cortisol levels, which also helps decrease heart rate and decrease blood pressure. Meditation. So meditation is easier said than done. It really takes a lot of energy to do meditation, but even trying to silence out the outside noise for a minute, for 2 minutes can also have lasting effects. Sometimes we're in such a hurry, thinking, I don't have time. And then you're actually not as effective as you would have been. So maybe taking that 1 to 2 minutes to just kind of relax, calm down, will make you run more efficiently and be more productive. Because if you're really tired and stressed, maybe it's going to be you won't get as much done as you think you're getting. We already spoke about positive thinking. There's data to say that you can even alter your neurotransmitters, for example, and certain hormones in your body if you change your thoughts. Muscle relaxations, that's a great way. Sometimes you don't realize how tense you are until you focus on it. So you just focus on tensing all your muscles and then slowly releasing them. And you'll realize sometimes I have patients, for example, that have back pain, neck pain, jaw pain. It's because they're always tense. So try to relax your muscles. Visual, guided imagery is a great way. Visualizing yourself in a happy place, whatever your happy place may be. That's specific to each patient. It could be in a beach, it could be in the mall, whatever it is, but just imagine yourself there and that can help you. I also use that as a motivation for my patients who have diabetes, for example. I say, what is your motivation to change your lifestyle? It's hard to change old habits, for example. And you start thinking, what's my motivating factor? Why should I do this? Some people say, you know what, I want to do it so I can be around for my grandchildren. I want to do it so I can enjoy my retirement and actually, enjoy all these hard years of hard work. So visualize what is your motive? What is your why? Why do I want to be around to see, right? I want to control my diabetes so I can have good vision, so I can walk on my own, so I can be independent, so I can have cognitive function, but I don't have a stroke and I'm debilitated in that sense. What is my why? Identifying, visualizing that why will really help you try and make it easier. It gives you more motivation to make the changes you need. You know, is the soda, is that bread, is that croissant really worth me having a high sugar that can have detrimental impact on my health? Exercise, again, even I'd say movement in general, yes, the recommendation are 30 minutes a day, at least 5 times a week. However, so you do want to break a sweat. That's the ideal, because that's really where you hit the peak where you release hormones in your brain that and throughout your body, endorphins, serotonin, dopamine. There are natural antidepressants. Many patients that, we give them medicines for depression, but you have a way of creating natural antidepressants, and that comes in the form of exercise. Many people forget that they have that power. So yes, meditation can do that for you, but also, give me 1 second. But also we can have meditation can do that for you, but also exercise. Exercise can cause you to release serotonin levels, dopamine levels, things that can increase your mood, make it feel better. And then opening it up. And there's a lot of data. We can do a whole series on this, just not repressing your feelings. Many times finding a healthy way. So the goal is finding a healthy way of letting out those feelings, but sometimes repressing feelings, whether it's feelings of resentment, of hurt, of guilt, of unable to forgive, all of these emotional, all these feelings are bottled up and they cause stress. At a slow running a bit of stress in your system, and that can be seen in your glucose levels, believe it or not. Let's say something happened the day before, you keep quiet, but it's just bottling in, festering in, and all of a sudden you see your sugars creeping up. Believe it or not, it's because of the stress. It's because of whatever it is that you're dealing with. And that's also applies to blood pressure. And that also applies sometimes to body aches. I mean, patients that have just generalized achiness and pain. Hey, that's the way that our body says, well, you're not paying attention to my mind, so let me manifest it in the physical organism. So again, these things can definitely alter your glucose level and your overall health. That being said, and that can eventually lead to depression. And when you're depression, there's a lack of motivation. And then that leads to saying, you know what, I don't care. And then you eat anything because you're trying to self-soothe. So there's so much that can go on when you have all these bottled up emotions. And know that there are resources. Even with COVID, one thing that we realized with telemedicine is that a lot of psychologists decided to go on apps. So there's a lot of things that you can actually find online, app, telemedicine, where you have someone that you can go to have a conversation, do a video visit where you can talk about your issues.
Definitely. I want to add that, stress can also lead us to making poor dietary choices. Also, when we're stressed, we might not be eating mindfully. And so we're eating just to kind of cover up feelings. Food is very comforting. If we're also under stress, we might not be sleeping well, which can, lead us to having very sluggish days. And we know when we're tired, we make poor dietary choices as well. Our brain craves sugar to get through the things that we have to achieve during our workday or just regular, all the responsibilities that we carry. So then stress is tied to a lot of negative ways of impacting ourselves and managing our diabetes.
Absolutely, Maria. Even going back to that, let's say you're stressed and you can't eat. So now you're here and you can't sleep, rather. You're stressed, you can't sleep, and all of a sudden you wake up. What do? You feel like you want to have a snack. So even something as little as that, absolutely. And we see it. We see it day to day, how stress can cause all of these things. So absolutely. So going on to the next slide. So in this slide, so how does physical activity, movement, overall improve diabetes? So we talked about the mental aspect of it. We talked about how you release endorphins, serotonin, and all that helps you. But there's also an actual physical change that occurs when you exercise. So yes, people can lose weight with exercising. It helps you burn fat. It's the best way of burning fat, right? Because it really makes you tap into those fat stores in your liver, for example. That's in your heart, because sometimes fat attaches to your liver, it attaches to your heart. it attaches to other organs. So that helps burn that fat, but also it helps with what's called the insulin resistance, right? That's part of diabetes. So diabetes is, for type 2 specifically, it's a problem with the insulin receptors no longer working. So eventually you're producing insulin, just not working the right way. And then eventually you're not producing enough insulin. So there's two processes that are going on. So what exercise does is that it helps these receptors that are mostly located in obviously your organs, but also in your muscle mass. It helps the receptors work better so that the insulin works more effectively. So it also makes, think of this as, many people think is one or the other. I believe in complementary medicine, where it's, let's do both. Let's try to make the medicine that you're already taking work more effectively. Let's decrease the need to increase medication so that we can decrease the side effects of these medicines by adding your part with diet and with exercise. So exercise in itself definitely helps decrease this insulin resistance and makes your natural insulin work better. And also makes the insulin the medicines are making you produce work better. So again, it's a great way of controlling your weight. It actually helps control your hunger. It helps with body pains. Many people, your joints, everything aches because you're so stiff. If you stretch, if you walk, these pains get better. And also your glucose levels get better. So like I said, it's hard in general, because I see both diabetes patients and patients suffering from obesity and overweight, but even more so for a diabetic, if we can get you into the mindset of, part of my regimen, let's say after dinner, is that I need to walk so I can burn off what I ate, so that can digest better, and so that I can bring down my glucose levels naturally. That's something that you can do, something as simple as a 25 to 30-minute walk. But let's say now you can't do 25 minutes, even a 10-minute walk, even just walking around your block, especially now that the weather's still nice, is something that you can try to incorporate in your lifestyle. Okay, so next slide. So again, this is basically reiterating everything that we said. So, it helps insulin work better, helps you burn fat, strengthens your bones and muscles, and also may lower blood pressure. Let's go on to the next slide. So yes, in addition to the glucose levels getting better, in addition to helping you feel mentally better, in addition to the helping your joints feel better, you're also helping the heart, right? So you're the whole idea behind, in the ideal world, of doing 30 minutes a day, at least 5 times a week of cardio, is because you're helping strengthen that heart muscle. And we strengthen that heart muscle. No, it's a muscle. Remember, it's a muscle. So if you exercise a muscle, it gets stronger. So it can beat more efficiently. It helps you with blood pressure, but it also helps reduce cholesterol, which is also an integral part of diabetes management. Many patients have cholesterol medications. There's a natural way of decreasing your cholesterol, and also helping with circulation. Exercise makes that heart pump, makes all those vessels work, and makes circulation even better. Next slide. So how can I get started with an exercise plan? So like we said, talk to your doctor, talk to your diabetes care team, talk to your diabetic educator, and see, I want to start a change. What do you recommend? I personally recommend, and Maria and our team, we're trained to recommend small baby steps. I think that small baby steps goes a longer way than making a drastic change, and then you feel you can't achieve and then you give up. So I think that's getting attainable goals. We say choose your activity, so something that you enjoy. That's always been what we tell patients. Like I said, walking, swimming, if it's dancing, some people love Zumba, whatever it may be. Make it fun, make it sustainable. For people, when you have your kids, for example, you want to incorporate physical activity for the entire family. Why not do just a dancing thing in between commercials? Hey, let's all stand up, let's stretch, let's dance for 5 minutes. I remember my mom used to do that on weekends. She used to make us all dance. So that's a great way of incorporating physical activity. And then, so here it comes, about checking your blood sugars. The older medications for diabetes tended to cause more hypoglycemia or low sugar attacks. The more modern medications actually are better because they just work when you eat. So I'm actually not so concerned about a drop, like a dangerous drop in your glucose level, unless if you're on insulin, or if you're on something called a sulfonylurea, such as glipizide, glimepiride, or short-acting metaglenide, something like Brandon, which is known as repaglinide, for example. So if you're on those medicines, then yes, you do run a risk of having a drop in your sugar. So if you're on insulin or one of these oral pills called glimepiride or glipizide, for example, or Prandin, then yes, you can have a drop in your sugar. But if you're on the other medicines, such as those once a week injectables, under the name, for example, of, let's say, Trulicity or Ozempic, or the daily one like Victoza, I'm just giving you some names, or the newer one called Rybelsus, that doesn't cause a low sugar attack, and neither do these other class of medicines, such as the SGLT2 inhibitors, such as Jardiance, Farxiga, Rocamina, Stiglatro, and also metformin. So those are better in the sense that they do not cause hypoglycemia, so you do not have to have that fear that, oh, my sugar is going to drop, because many times that holds people back from exercising. And if you find yourself that you want to adopt a new lifestyle change and you want to start exercising on a day-to-day basis, and you are on insulin and you are dropping, let your doctor know so you could have a new, that doesn't, many times people have this idea, well, my sugar is dropping, I need to eat a snack. No, why not consider decreasing it on the insulin? That's a mindset that we want for our kid, for in general, for the care for diabetes. And next slide. So we want to wearing a medical identification tag. I always tell people, just in case, try to wear a medical bracelet. You never know, especially for my patients who are insulin dependent. We want to wear a bracelet because, let's say, God forbid, what we don't want happens, which is maybe you pass out from a low sugar attack, let's say, or you reverse a very bad hyperglycemic event that causes you to pass out. You want whoever is trying to give you help to know what to do. And having a medical identification tag for diabetes or for any other chronic illness is very helpful. Caring for your feet, that's a big one. So what's the fear that many people have with diabetes? Oh, that I might lose my toes, I might lose my foot. Because sometimes with uncontrolled diabetes, you get numbness in your feet and you can't feel it when there's a little cut. So the cut is brewing, getting infected, you don't feel the pain. And then all of a sudden, by the time you see it, it's too late. So always look at your feet, look in between your toes, and wear shoes that are meant for diabetics, that don't give you a lot of friction. They're not too tight, because all those things can create sores and blisters. Drinking water is great. I think of it as a way of flushing out the toxins from your system, keeping your sugar levels low. And you need to hydrate. So that's very, very important. And also, don't push yourself too much. If you're a person who has not been used to exercising, do it gradually. You don't want to do something all of a sudden and hurt yourself. And let me see. So I'll turn this over now to Maria Fraga, our dietitian. She'll go over, how can we start changing the diet? So she'll be giving you some tips.
Wonderful. Thank you so much, Dr. Pena, for all that wonderful information. And so what I'm going to focus in on in this webinar is, where do we get started with healthy eating and meal planning? And so typically when I see a patient, I like to take a diet recall to kind of understand what you're drinking, what you're eating, what are your habits during the day? Are you having snacks? What kind of snacks are you choosing or carrying? What are your beverages? What do you drink when you're thirsty? Are you adding sugar to coffee and tea? Are you making meals ahead of time? Are you meal prepping? Are you cooking for additional meals? Do you have certain restaurants? Do you dine out during the day when you're at work? Do you have food at your work desk? These are all habits that people kind of typically, adhere by, and habits are things that we do day after day. So what we're doing with our patients is, when we come together with them, is how can I bring forward to you ways to start a new goal, or what can we do together to work towards your goal, which basically is what we do together with our patients. I mean, we're here to manage your care and to make you the center of the team. We want to make sure we're guiding you and supporting you. And it's important to be very, very realistic with goals that we set forward. I know a lot of patients want a lot very fast, but it's more realistic if we work slow and build on the goals from visit to visit, from month to month. Next slide. For many of you, you have seen this picture before. It's the plate. It's how we should try to choose our foods in looking at our plate in 3 parts. I always think of filling half of the plate first with your favorite vegetables or a big salad, don't measure vegetables, go for 2 and 3 and 4 servings of veggies. There's so many wonderful ways to make your vegetables tasty using herbs and spices, different cooking techniques. There's air fryers now, there's grilling and roasting. So there's a lot of great things you can add to your vegetables, herbs and seasonings. And then 1/4 of your plate should be your lean protein, your chicken, your fish, your lean meats. And the carbs should only occupy 1/4 of your plate. That's the food group that will definitely impact your blood sugar and your diabetes values. And so for people who are managing diabetes, it's very effective to test your blood sugars 2 hours after eating, so that you more or less know the carbs you've chosen to eat and how they're impacting your postprandial blood sugars. And we say that American Diabetes' goal for 2 hours after eating is to have a blood sugar of 180 or less. That would be ideal. But again, these numbers are set with your doctor, your endocrinologist, and so they don't apply to everyone, but typically is 180 or less. Next slide. Which foods can I eat? And that's a question that we are, asked all the time when patients come to visit us. Please tell me what I can eat. Tell me what I should not eat. Do you have a list I could follow? I mean, I wish it could be that easy, but we all come from different backgrounds and cultures. And there's one thing that we don't want to stop eating is the foods that we were raised eating. So think of like choosing fruits and vegetables, preferably fresh fruit, nothing canned. Nothing like dry fruit tends to be smaller in volume, very high in sugar. Think of reading your food labels, looking for whole grains, foods that are high in fiber, comparing your labels in the market. It takes a little time to really learn like what is a better choice. There's so much misconception with food labels. So, going to the supermarket and taking a little time on the shelf to pick your the best cereal. Which bread should I purchase? Low fat dairy. There's also other choices of dairy, such as not dairy, but like soy milk and almond milk tends to be lower in carbs. They come in non-sweet. And the lean proteins, again, like I mentioned, it could be beans, it could be fish, it could be poultry, lean beef and pork. And the healthy oils, obviously, for heart health would be like avocado, extra virgin olive oil. You can buy sprays, and that would also limit the amount of oil that is going into your cooking or into your pan. So, definitely that's the foundation of what can I eat, but definitely reading your food labels and trying to managing your calories in with exercise. If you have a sedentary lifestyle, then you need to be more careful with what you're eating because you're not burning those calories. And obviously you're not going to see the scale shift as quickly as you would like. So really being, very conscious about the calories you're consuming, the choices of food you're choosing. You can't compare, a batch of French fries to an apple. They're both carbs, but you're getting a different value nutritionally with an apple than you would get with French fries. Next slide. This is just a picture of avocado. Avocado has gotten a bad rap. Many people think avocado is not a good vegetable, but it is. It's a good fat. It's a monounsaturated fat, and it could be used modestly in salads, in a sandwich, in a wrap. It could be part of a breakfast. Again, it goes back to eating it in moderation, not having a whole avocado a day. It's really more about portion controlling everything we eat. Avocado is high in fat, and so it has more calories. And obviously fat has more calories than protein and carbs. So using our fat sources, with caution. Next slide. These are just superfoods, foods that we kind of like put out in one slide, just for all our viewers to really see. The Greek yogurt, the nuts, preferably buy them unsalted. Obviously, salt is very addictive. So if you buy something salty, you're going to crave more of it. And then you're going to be thirsty. And then, so basically for our patients who are on diuretics or are being more cautious with hypertension or blood pressure, choose things that are lightly salted or unsalted. Fruits and vegetables. I would go with all natural peanut butter. The low fat peanut butter tends to have more sugar. So again, read your food labels. And here we have a picture of the dark chocolate, which sometimes is thought of like the bad thing to stay away from. But again, if you have dark chocolate or your favorite dessert and you can possibly eat it in small portions and really savor it when you're having it, take time to really like smell it and take the moment to really consume it in a mindful way. There's a technique that we had in our previous presentation where it's about smelling something and using all your senses when it comes to eating. And if you're in the moment of that delicious dark chocolate, you don't necessarily have to have a lots of it. It could be done in a small portion, and it could just be as enjoyed as if you were to have a larger quantity. And the next slide. This is a 3-day meal plan. It's 1,800 calorie. It's a consistent carbohydrate diet, which means that every meal consistently has more or less the same amount of carbs. And for our patients who are carb counting or caution with consuming, carbs, the key behind consistent carb counting is that it keeps your blood sugar typically overall consistently the same meal after meal. If you have a salad for lunch and then you have a bowl of pasta for dinner, you're going to have a huge variation in blood sugars. But if you had a certain amount of carbs for lunch and the same for dinner, most likely the after meal blood sugars will be hopefully near a similar value. Here you have 3 different days, 3 different ways of eating. Again, I think key is to measure your food. Sometimes it's not that we're not eating healthy meals or making the right choices. It goes back to portion control, and portion control will also help with weight management and also will help us manage our blood sugars better. And the next slide.
Maria, to add to the idea of portion control, really
sure.
quickly, we can also have the idea of displacement, right? When you fill up your plate, like you show with the plate method, of more veggies and more lean proteins, you naturally end up doing more portion control with carbs. So that's also another tip. We kind of ensure that every meal has at least some of that vegetables, that fiber that really helps with portion control. But you don't have to think about it so much.
And I want now that you're talking about this, Dr. Pena, I remember a study where they had utilized patients where if they started their meal with non-starchy foods like vegetables and salad, they would have better 2-hour postprandial blood sugars because that sometimes led them to eat less carbs, and also the fiber at the start of the meal helped manage their blood sugars and the way the blood sugar spiked.
Absolutely. So yeah, that definitely helps because sometimes portion control is not that easy, especially if you're feeling hungry. But even just changing the order of how you're doing things, like Maria said, having maybe a salad right before you go for dinner, that can help as well. Yes.
And the next slide is just ways of estimating portions. Again, I go back to measuring, take the measuring cups and your tools out of your pantry and try to measure your cereal. I mean, I know that patients sometimes just, eat foods without thinking about the portion that they're consuming, and they'll come in to see us and, oh, they have this great cereal, but they may not be eating a cup of it. It might be 2 cups, and then they're having like regular milk and fruit, and they're adding granola. A lot of other things are being added. So measuring everything you eat, especially your carbs, is going to help you definitely better the management of your blood sugars. So avoid the sugar shock. Just really read your food labels just to identify which foods you should really not purchase and which foods are better for you to, consider just having a staple at home. And the next slide is, how to make your favorite beverage or beverages you're buying at your favorite coffee shops. Really, again, avoiding all the added sugars that could be easily found in iced coffees and these fancy drinks that we purchase and spend lots of money on buying. And then the next slide is basically alcohol. Alcohol is a fat and it has calories and it can impact your blood sugar and mask hypoglycemia. So drinking alcohol with diabetes is something to be cautious with. And thank you so much for your attending our webinar today. Dr. Pena and I are very happy to be able to share with you what we do every day here in our office.